Hello and welcome once again to my YouTube channel. Now in this video, I want to talk about some respiratory diseases or problems, and specifically, I want to talk about pulmonary embolism. Okay. Now this condition is affecting a lot of young people these days and taking their lives because it's a very critical condition. Okay. So I want to talk about some of the causes and how you can prevent getting pulmonary embolism. So what is pulmonary embolism? Basically, it's a collection of particulate matter, that's like solids, liquids, or air that enters the venous circulation and then lodges in the pulmonary vessels. When you talk about pulmonary vessels, you're talking about the blood vessels within the lungs. Large emboli can obstruct the pulmonary blood flow. And when that occurs, then you're going to have damage to portions of the lung, and then you have difficulty breathing. Okay. What is pulmonary embolism? Pulmonary vessel constriction and pulmonary hypertension occur, leading to reduced oxygenation and impaired gas exchange. All right, so the person will have difficulty exchanging blood from the alveolus, which represents the air sac, into the blood vessels. So pulmonary tissue hypoxia results in potential death, right? So hypoxia is reduction in the supply of oxygen to any tissue. So many people die within an hour of pulmonary embolism dislodging before even diagnosis occurs. So it's a very serious condition. Pulmonary embolism most commonly results from having like a black clot from DVT, which is deep vein thrombosis, and it breaks loose from one of the veins in the legs, and then to travel through the blood vessels. And it can also be from blood vessel from the pelvis. So, what are some of the causes of pulmonary embolism? What we refer to as the etiology of pulmonary embolism. One of them is prolonged immobilization. Prolonged immobilization. People sit down for long periods of time, like say playing video games and traveling over long periods and so on. So it's very important that patients bend their legs and try to walk around in order to get circulation moving to prevent thrombi from forming within stagnant blood. Because when you sit down for a long time, now there's stagnation of blood within the legs. And once you have stagnation of blood within the legs, it can lead to the formation of blood clots. So it's very important to move the legs if you have to sit down for a prolonged period of time or walk around, especially when you're in the plane. Get up after, let's say within 1 hour, get up and walk around a little bit, okay, to get the blood moving or flowing within your legs. Another cause is having central venous catheters. When a catheter is put in, it can also be a source of blood clotting. Surgery, surgeries. Having a surgery can also increase the risk, especially when the person lies in what we call a lithotomy position. That's the knees and hips are bent during certain surgical procedures, and that can also increase the risk of having pulmonary embolism. And also the fact that somebody is obese can also lead to increase in the clotting of blood. So obesity is a risk factor. And then advancing age. As you grow older, you're more likely to have deep vein thrombosis because you're more likely to have problems within your blood vessels like atherosclerosis and other things occurring within your blood vessels. So you're also at risk. And then having a history of thromboembolism, can also increase your risk of having pulmonary embolism. And those who smokers can also have an increased risk of pulmonary embolism since smoking leads to damage to the lining of the blood vessels. This person also had heart failure. Heart failure, there's an increased risk of having pulmonary embolism. Trauma to any part of the body, you end up releasing clotting factors from the damaged tissues and can also lead to increase in developing pulmonary embolism. And fat emboli. Yeah, if fat goes into the blood, for example, from a bone that is fractured, the long bones, they have a lot of fat in them. So if the bone is fractured, you can have pulmonary embolism as a result of the fat being dislodged into the blood. Pregnancy also increases the risk of having pulmonary embolism, okay, because pregnancy can lead to stagnation of the blood within the legs, because the uterus tends to become enlarged, and then it can impede the blood flow. It compresses some of the blood vessels within the pelvic region, and that can impair the blood flow. That can lead to stagnation and clotting of the blood. This person receives estrogen therapy, that increases the risk of clotting. So pulmonary embolism can also occur. Cancer, especially lung and prostate cancer. Okay. People who have that, they are more likely to develop pulmonary embolism. And then a condition known as Trousseau's syndrome. Okay, if you have that, you can also have increased risk of having pulmonary embolism, right? So those are some of the common causes of pulmonary embolism, but especially the young ones sitting down for a long period of time, playing video games, moving around, that has increased the risk of people developing pulmonary embolism. It's something that can easily be prevented, so we need to educate ourselves, especially the young ones, need to know more about this, so that at least they can prolong their lives a little bit. Right. So how can we intervene or prevent pulmonary embolism from occurring, right? So let's look at some nursing focus on prevention. Now, you can prevent DVT, one, if you prevent deep vein thrombosis. Then you can also prevent pulmonary embolism from occurring, right? So prevent deep vein thrombosis. We just set up, we talk about, moving the legs frequently, walking around so the blood will flow. So if you can prevent deep vein thrombosis, you can prevent blood clot from forming in the legs that can dislodge and get into the lungs to block the vessels in the lung. Also, if you're a smoker, just stop smoking. If you stop smoking, it goes a long way to prevent pulmonary embolism, especially in women who are taking oral contraceptives. Very important not to smoke. Okay. And then weight reduction. If you are overweight or obese, weight reduction can help in reducing the risk of pulmonary embolism. And in general, increasing physical activity, exercising, walking, swimming, and playing football, soccer, and other things. Increased activity. All this can lead to a reduction in pulmonary embolism. So if, as I said already, if you're traveling or sitting for prolonged long periods, get up frequently, every hour for about 5 minutes, and drink plenty of fluids. These are simple ways we can all prevent pulmonary embolism from occurring. It's good for us to educate each other so that at least we can enjoy each other's life more, can improve the quality of life. All right. So how does pulmonary embolism manifest? What are some of the symptoms of somebody having pulmonary embolism? One, let's look at it, respiratory symptoms, right? So the person suddenly has difficulty breathing. That's what called dyspnea. Dyspnea, difficulty breathing, which comes on suddenly, right? Then there's tachypnea. Person breathes very fast, fast. And that's called tachypnea, rapid breathing. Okay, because person is now having shortage of oxygen. So it has to breathe faster to compensate for that lack of oxygen or reduction of oxygen getting to the blood. Tachypnea, And then if the doctor or whoever is taking care of the patient hears what we call periodic friction rub, with the stethoscope, he's going to hear that rubbing sound, within the chest, or have what we call crackles. Crackles, if that can be picked up by the stethoscope, the person may be having pulmonary embolism as well as person has dry cough, and may even have hemoptysis. Hemoptysis is blood in the sputum, having passing blood in the sputum, coughing of blood. If these signs are present, then the person is likely to be having pulmonary embolism, right? And then some cardiac symptoms, what happens to the heart? So within the chest, the person will having sharp stabbing chest pain, sharp stabbing chest pain, right? And then the heart will be beating very, very fast, which we call tachycardia. And then if you look at the neck veins, you see distension of the veins. The veins will be distended, so we call distended neck veins. And then person may even have syncope. Syncope refers to fainting spells. Yeah, person may feel like fainting or even pass away or pass out. Rather. Then cyanosis, okay, due to lack of oxygen going into the blood, you see that person will be turning blue, okay, bluish. You look at the nails, under the eye and other places, the person becomes pale, that's primarily bluish color. Then you having cyanosis occurring. And then the blood pressure can reduce. You have hypotension, reduction in the blood pressure. And then if the doctor or the clinician listens to the heart, the person will hear abnormal heart sounds, which we call S3 and S4 sound. And if ECG is done, with some called the EKG, when that is done, you have you find some abnormal findings on that. Later we can talk about the findings I see on the ECG or EKG. In general, see that the person will be so restless. So there's restlessness. And then there's diaphoresis. Diaphoresis, the person will be sweating. And there'll be low grade fever. You also see petechiae for the chest and the axilla. Petechiae refers to a pinpoint hemorrhages that you see on the skin. The axilla is the armpit area. So you may see the person and then the person will be having like flu-like symptoms. So many patients with pulmonary embolism, they do not have a classic manifestation, but instead they have those vague symptoms representing or resembling the flu, such as nausea, vomiting, and malaise, and maybe some general malaise. Okay. So you can mistake this to be like a flu, right? It's a very serious condition, that needs immediate diagnosis and treatment, especially the decreased oxygen saturation in the blood and needs to be taken care of. All right, so How is this assessed? Assessment for the following symptom cluster or cluster of symptoms. So you have to look for the distended neck veins, syncope, cyanosis, hypotension. If this cluster is present, you have to notify rapid response. Very important. Very important. So distended neck vein, syncope, print spells, person turning, cyanosis, and hypertension, dropping blood pressure. Rapid response has to be initiated. And then, what are some laboratory assessments that can be done? Laboratory assessments. One, it's abnormal blood gases, ABG, right? Abnormal blood gases. Respiratory alkalosis will occur due to hyperventilation triggered by the hypoxia. Right? Hypoxia triggers hyperventilation, and that can lead to respiratory alkalosis. And there will be low partial pressure of carbon dioxide, low carbon dioxide, so partial pressure of carbon dioxide in the blood. Later on, metabolic acidosis occurs from building of lactic acid into tissue hypoxia. Anytime the tissue has oxygen, then one of the substances known as pyruvate, that's generated during the cell respiration process, the change to lactic acid, and that leads to the metabolic acidosis. And then there's decreased oxygen saturation. So those are some of the laboratory findings. And if you do imaging assessments, you chest X-ray, the X-ray may show signs of pulmonary embolism if it's large, right? If it's large. Some lung infiltration may be present around the embolism site. And then if you do CT scan, most often used to diagnose PE, you may see some signs of pulmonary embolism, CT scan as well. So what are some interventions? One of them is oxygen therapy. The patient may need mechanical ventilation and close monitoring with the arterial blood gas studies. Right? May need nasal cannula or mask in less severe cases. And then pulse oximetry will be needed to monitor the oxygen saturation and the hypoxia. Okay, so oxygen therapy is needed in this case to increase the saturation, oxygen saturation of the blood. Okay, so when intervention has to focus on one, increasing the gas exchange. Two, improving lung perfusion, improving the lung perfusion. Want to improve the amount of blood that comes to the lung, right? And then reducing the risk for further clot formation. You don't want it to occur. Remember, the person has once like to have it again. You want to reduce the risk of clot forming. And then also want to prevent complication from the embolism, because the emboli can go anywhere in the body. And once it's blocked, a blood vessel can damage several organs, depending on the organ that it lodges in. So you want to prevent complications from occurring. So, we need to prioritize the nursing intervention here. And this includes one, oxygen therapy, administering anticoagulants or fibrinolytic therapy. We want to break down the fibrin that involve in blood clots, right? So the general practice is to reduce clotting. So you can get anticoagulants or fibrinolytic therapy. And then you monitor patients' response to the interventions. And you need to give psychosocial support. Very important to give that psychosocial support to the patient and family. Okay. All right. So what are some of the continual patient monitoring that can be done as a nurse? One, you have to monitor the vital signs, monitor the vital signs, monitor the lung sounds, make sure the lung is functioning well. And the cardiac respiratory status has to be checked 1 to 2 hours, every 1 to 2 hours, you need to do that. And you check for dyspnea, check for dysrhythmias, check for distended neck veins, check for dependent edema in the feet and the sacrum, right? You want to make sure the heart is working very well, and the respiratory system also working very well, okay? And also check the oxygen saturation, check the lips, the nail beds, oral mucosa, the conjunctiva for signs of cyanosis. You have to check that for signs of cyanosis. So those are some of the nursing interventions that can be done. Now, drug therapy using the anticoagulants. It's very important to check the labs to decide which anticoagulant that will be needed, whether heparin or warfarin. Okay. So this will depend on the evidence from the lab results, But heparin is usually used. Heparin is usually used here. You want to avoid the use of heparin if the following is present in the patient. One, the person is bleeding. You can't give that. If the person has a stroke, what we call hemorrhagic stroke, heparin has been avoided. Person has recent trauma, heparin has been avoided. So this is very important. Okay, avoid these treatments when it's bleeding, stroke, or what we call hemorrhagic stroke, or recent trauma. Heparin has to be avoided. Very important to note that. Okay. Now, what are the fibrinolytic therapy? Okay. And this indicated if the pulmonary embolism is massive or occurs with hemodynamic instability. All right. So fibrinolytic drugs, they break up existing clots. They break up existing clots. Okay. And what I think that you need to check, you need to check the partial thromboplastin time. The PTT has to be checked, and then the APT time, activated partial thromboplastin time. These things have to be checked. If you have to go that route, use the fibrinolytic drugs to break up the existing clots. Before therapy is started, you need to check that. Okay, you check the PTT and the APT. And then this has to be done every 4 hours when therapy begins, and then daily thereafter, right? So it has to be checked before therapy is started, 2, every 4 hours when therapy begins, and then daily thereafter. Okay. Now the therapeutic partial thromboplastin time should be between 1.5 to 2.5 times the control value. Okay, that is what we want to aim for, right? Now there's a risk for excessive bleeding. There's a risk for excessive bleeding during these therapy sessions, okay, when you give the drug therapy. This can occur with both heparin and then the fibrinolytics. Okay, so you have to be on high alert. Okay, so both high alert, they're both high alert drugs. You have to keep eye on the patient closely, close eye. Okay, I can't stress that enough. Okay. So some tips to remember for the antidotes. Okay, so heparin antidote is equal to protamine sulfate. Warfarin antidote is vitamin K or injectable fentanyl dione. Okay. Antidote for fibrinolytics, clotting factors, fresh position plasma, and amine caproic acid, amica. Right. Those are some antidotes for the drug therapies. Okay. If there's any adverse effects about given too much of them, these medications are used to reverse those side effects. Okay. So good to know this for nursing exams. Then you have other treatments. You have surgical management that can also be used. One of them is embolectomy. And this surgical removal of the embolus from the pulmonary blood vessels. This indicated when fibrinolytics cannot be used, and as patient has like massive or multiple large pulmonary emboli with shock, right? So it indicated when fibrinolytics cannot be used in such patients who have massive or multiple large pulmonary emboli with shock. Then we have inferior vena cava filtration. Inferior vena cava filtration. The life-saving measure by preventing further embolus formation. It catches the emboli that travels up to the lungs from the lower extremities, right? And some can be removed. Okay, some are removed just by filtering the inferior vena cava, the blood vessel that brings blood to the lung from other parts of the body. You put a filter in there, and you can trap some of these things. Okay. And then when the patient is being discharged, you have to manage the hypotension. You want to minimize bleeding, and also want to minimize anxiety. Okay, so we need to teach the patient about some of these things before they are discharged. So in summary, this is what pulmonary embolism is all about, and some ways in which can be prevented, and some ways in which they can be treated. I hope you've enjoyed this video, you've learned a lot. Please share with others so that we can save people one at a time. Have a wonderful day. Bye-bye.